The AMA compared a survey on digital health adoption collected in 2019 and 2016 and found a small but significant increase in the advantages that physicians feel digital health can bring to their patients. Clearly, that's changed. He goes on to talk about that. I can only imagine what these data would look like today, Ehrenfeld said, noting that the data was collected pre-COVID. The survey zeroed in on 7 types of tools. And this is what I'd like to talk to you about, including remote monitoring for efficiency, remote monitoring and management for improved care, clinical decision support, patient engagement, televisits, point of care, and consumer access to data. He goes on to say doctors are especially interested in monitoring their patients outside the 4 walls of the hospital or clinic, which happens to be where you were living, while all digital tools have seen an increase in, well, I'm going to just skip to the end here. The survey results show that the number of physicians interested in adopting augmented intelligence tools is very high. However, current adoption, at least as of 2019, is very low. Let's talk about this statement. Doctors are especially interested in monitoring their patients outside the 4 walls of the hospital or clinic. Do you think that was the case a couple of years ago? And do you think that's changed?
I don't think you can talk about doctors as a monolithic entity. I think it totally depends on what type of doctor, what type of patient. Specialists who work with people with chronic diseases, absolutely. And they're frustrated that it's, first of all, hard to do. And second of all, how do you get paid for it? Your average sort of primary care probably doesn't want to. And maybe there's also they want someone to do it. I don't know if the doctors want to do it.
Right.
Which is probably correct, right? The orthopedic surgeon wants good outcomes from the patient, but they're not the ones who are like, do your exercises, right? I think doctors want the access to the information. They want to help patients, but there's also a little bit stuck in the system, right? It's all about reimbursement. And so reimbursement, it's 3 things: reimbursement, liability, and time. Those are the barriers for them.